Love and fear. Those are the two driving forces, and in fact I heard the other day that fear is a stronger driving force than love, which is a sad reflection of today's society, but nonetheless I probably believe it. As far as dental sleep medicine is concerned, many people might just love it, and you kind of need a little bit of love in instituting this into your practice, simply because you will need something to carry you over the bumps, and a love of what you're doing should be enough, or even the desire to do so. Fear of not doing it, well, you can have fear of doing it, of course, and that's what this support is supposed to be about, because there's a lot of fear of doing things because you don't want to get into trouble, and there's probably more fear about whether or not we should be doing it, because if we don't do it we're going to get into trouble. The issue here is, I think, that one day the chances are, probability is, that we are going to be faced with this as a standard of care. I remember, because I'm of that vintage, that there was a time when you would check the gums because that was appropriate. You would then do a soft tissue check because that was appropriate, and you would do a jaw joint check and see how far a patient could open and ask if they had any problems, and that was fine. That was good. Those were things you did because they were ethical things to do, and because it was just appropriate. You were a dentist. Then, and we won't say why, but the regulatory departments decided that they would make that a standard of care, and I don't happen to disagree, but nonetheless they are. And so for someone who sees their patient and doesn't do a periodontal check of any kind, makes no notes of having done it, and doesn't do any probing at all, they are not fulfilling the standard of care. For those people that don't do a soft tissue check, you're not fulfilling the standard of care, we're told, and that's perfectly reasonable. You know, more people are going to die of obstructive sleep apnea than oral cancer, or sorry, the consequences of obstructive sleep apnea than oral cancer, but nonetheless that doesn't denigrate the importance of the soft tissue and cancer screening, soft tissue check and cancer screening. And then the last one, of course, is TMD, which is still glossed over a little bit, but that's important. Now, to look at this from a regulatory department, I think it is probable that this is going to become a standard of care. And if it is going to become a standard of care, we need a base knowledge, even if we're not going to provide the care. You know, are you providing care for TMD? Are you providing care for deep-pocketed periodontitis? Are you providing care for severe facial pain or TMD? Well, possibly, possibly not. But, you know, in a case of obstructive sleep apnea, if you're not, you should be referring. If you are, that's what this is all about. So I don't think there should be fear in either doing it or not doing it. I think you need to understand the reasons, and I think you need to look inside to see what your motivating forces are. But I think that a basic knowledge is important because it'll keep you out of trouble. It'll also keep patients out of trouble.